Okay, so I'm going to go over a couple different inhale medication devices and then sort of how to do them or instruct your patient on them. So the most basic one, or the first one, I think a lot of people are familiar with, is the handheld puffer, or MDI, metered dose inhaler. This one is really nice. It's got a cap on it, that a mouth cap that actually stays attached. Oftentimes it's actually a separate cap. This one's nice because you oftentimes will lose that separate cap, so just kind of important to mention to your patient. And before you use them, you want to shake it to activate the medication in there. So ask your patient or remind them, shake it really well before each use. And then if they can, and a lot of people can, coordinate the breathe out first, and then they'll put this to their mouth, and they can coordinate with their own muscle movements. They're going to press on the canister and breathe in at the same time to get the most out of that medication. It is helpful to note, if they haven't used it in a while, to spray the medication out somewhere else, out into the air, not at anybody, just to prime it to make sure that it's still working too. So that's sort of basic without anything, the puffer with the mouthpiece. A lot of people nowadays do have this, it's called an Aerochamber, that's the brand name. It's sort of, it's a spacer device, you'll also hear it called. And so this helps to hold the medication for a little bit longer, so it doesn't disperse into the air as quickly if the person can't coordinate those movements as well. So with this Aerochamber spacer, you're going to put the mouthpiece into the back of the Aerochamber like that. And it again has a mouthpiece here, and you're going to the person help them put it to their mouth or instruct them to put it to their mouth, seal their lips around it really well. Jake has a hard time doing that. And then they're going to press their canister and take deep breaths in. This one says to sort of slowly but fully take those deep breaths in. Some of them do have sort of a mechanism on them that makes a whistle sound. If you suck too hard or too fast, that will tell you that you're kind of breathing in too hard. So you just kind of want to breathe in at this slow but steady and full rate. If you are doing multiple puffs, sometimes it'll be ordered, say, 2 puffs every 4 hours. You want to wait about 30 seconds between puffs with your puffer or with the Aerochamber. And they also do say, after you've done the inhalation, you want to try to hold your breath, or instruct your patient again to hold their breath for about 5 to 10 seconds afterwards before fully exhaling, to try to get the most out of that medication again. So that's the Aerochamber. The other sort of advancement to an Aerochamber, or added piece, they do have some that come with a mask on them. That's a little bit more helpful maybe in the pediatric realm, where the young person can't quite coordinate holding it or keeping their lips around it. So you can secure it over their mouth and nose, and then do the puffs for them, and then you just kind of let them breathe it in. So that's something. You may see an Aerochamber with a small mask attached to it. That's what that is. Another common puffer device is the Discus. So it comes like this. It's oftentimes Advair is the medication that comes via Discus. So to instruct your patient on this, or to understand it, how it works, you pull this. It's kind of got this nice thumb imprint here. You pull this open, and you hear it click or lock into place. And then you can kind of see that there's an obvious mouthpiece here, so you kind of want to avoid handling that. And then there's a nice sort of dial here, switch, that you pull back and also makes a clicking sound. That's activated the dose in here now. So now your patient, or the person you're teaching, can instruct them to take a deep breath out, and now they're going to put this to their mouth, seal their lips around it, and breathe in. So you can kind of hear it rattle as they breathe in. And there's also, you want to remind your patient of this too, especially if they're going home with a Discus, that there's a counter here that will count down. So depending on how many times they use this, or ordered or instructed to use this in a day, they want to keep a close eye on that counter, because you want to make sure you don't suddenly run out of medication. So when it's a couple doses left, they may want to refill. This one actually is at 0 right now, but usually they start at 50 or 25. So you'd want to tell the patient to keep an eye on that one too. Another type of delivery of system for puffer is a turbohaler. I have a hard time saying that one. I always want to call it a tuberhaler. And it's sort of like a tube shape. So it comes with a cap on it. Symbicort is one medication that's often delivered this way. So it comes with a nice cover or cap on it, so you can kind of take that off, put it aside, and you can see again there's an obvious mouthpiece at the top. There's a counter on the side there, and the base is where you're going to twist from. So for this one, you twist it forwards and then twist it back, and you hear that click sound, and the counter should count down. And same idea, this is then when it's ready to be inhaled, once you've activated it, and the person can take their deep breath in with the medication. And then you'd want to recap it after use. Finally, another common one is this handyhaler, it's called, kind of like this egg-shaped inhaler. And this one is commonly used for Spiriva. So this one opens just like that. And again, you can see that obvious mouthpiece there. There's also a nice little window through here, and we'll show you what that's for now. If you continue to lift back the mouthpiece, and avoid, again, touching the part where the person will put their mouth. Can open it all the way up. It comes with pills, actually, or capsules. These are not for swallowing. You want to make sure to make that really clear to your patient. These are to go into your handyhaler. So you'd open up your, kind of sits nicely on its base there most of the time. So you'd open this up. Want to make sure your hands are clean. You can sometimes actually pop it in this way to the device. Oh, this one's staticky, actually. It's being held in there. If you did need to touch it, again, make sure your hands are clean. And we're going to close up our device. Oftentimes that white part will just shut, and you can lock it in place. And this one, maybe you can see it in lab. We'll have some more to practice. But if you watch through that window, you'll actually see when you push this button, a device come through and stab the capsule. So the patient or resident will actually be breathing in the medication that's dispersed once that capsule is stabbed or punctured. So again, same thing, ask them to take a deep breath out, and they can take close their lips around the mouthpiece and take full steady deep breaths in to inhale that medication. And in this one, you definitely hear that capsule rattle inside the device. And they actually say you can keep doing this, keep breathing in on one pill until a couple times to actually fully empty that capsule. And then when you're done with this one, you can lift up the mouthpiece and then discard it into the garbage can. So that it's empty again for the next use. And this is sort of what the pill pack kind of looks like. Most often for Spiriva, it's sort of in this silver packaging because it shouldn't be exposed to light for very long. So they keep it in this sort of opaque container so that it can't be accessed by light. Some important things, and again, we've talked about this, or you'll read this with puffers, is that you want to remind your patient and encourage them to rinse their mouth out after using puffers. Most commonly, or most crucially, I should say, with steroids, so that they don't get that candiditis in their mouth. But really with anything, it kind of helps to just rinse that medication out of their mouth, and then rinse and spit. Don't rinse and swallow, because then you're, again, swallowing that medication potentially. So you want to rinse really well and spit after. So just reminding your patient to do that's important after puffers. All right. Good job, Jake.